Welcome to our second episode. This is Care for a Healthy You. This month we will be discussing diabetes. At the end of our time together, we hope everyone has a better understanding of the disease process and treatment options and how the rehab services can help in the recovery of patients. We hope to see you next month. We will be learning about pain management. Hi, I'm Chad Waterman, the Assistant Administrator here at Care One at Lexington. I'm here with Dr. Merchant, Associate Clinical Professor of Tufts School of Medicine, Clinical Instructor at Harvard Medical School, the President of AMDA Society of Post-Acute and Long-Term Care Medicine, Massachusetts and Rhode Island chapters. Today we're going to be talking about diabetes. Dr. Merchant, what is diabetes?
So diabetes is a disorder where the body doesn't handle glucose correctly. The simplest fashion, that's what it is. Now there are varieties of diabetes. You've probably heard of, type 1 diabetes, where the body doesn't make enough insulin. There's type 2 diabetes, where the body may make enough insulin, and sometimes it makes more than enough insulin, sometimes less than enough insulin, but it doesn't handle it quite right. So most of the glucose is used for every cell in the body, and the glucose doesn't get delivered well into the cells. Hence, there is too much of sugar in the blood.
Dr. Merchant, what are some symptoms of diabetes?
So the common symptoms of diabetes are increased thirst. You have to use the bathroom a lot of times, so a lot of urination, and sometimes blurry vision. But most of the times it may go unnoticed for a while.
If type 2 diabetes rarely causes symptoms, why should I care about it?
You should absolutely care about diabetes because it can be that silent, killer. It increases your risk for cardiovascular disease, it increases the risk for strokes, it increases the risk for kidney disease, and it can lead to kidney disease. It can cause, loss of sensation, loss of function in your extremities and your legs, and it can also cause vision problems. So that's only to name a few, but as you see, the disease can affect many parts of your body.
What are some of the causes of diabetes?
So, in general, we'll talk a little bit more about type 2 diabetes. What causes type 1 diabetes? It's an immunological disorder where, our pancreas makes insulin, and some of the cells that make insulin are destroyed by an immunological disorder in the body. For type 2 diabetes, there's a high risk if your first-degree family member or your immediate family member has diabetes. The risk can be as much as 5 to 10 times higher in your relative. Also, diet and weight gain, level of activity can cause diabetes. So if you're overweight or obese, you have a higher risk of getting diabetes. If you have a family history of diabetes, you have a high risk of getting type 2 diabetes. There are some environmental factors. What you eat may be important. If you're not exercising enough, that can lead to diabetes as well.
Great, a lot of great information. What are some of the blood tests done in diabetes?
So the common blood tests we do is, measuring your glucose in the blood. We can do a random glucose, that is any time of the day. It can be a fasting glucose when you haven't eaten for 8 hours, or an overnight fast and you check your blood sugar the next morning. There can be what's called an oral glucose tolerance test, where you're given a special drink which is loaded with glucose, and then blood test is done at 1 hour and 2 hours after that. There's also a blood test called the hemoglobin A1C that tells us, how your diabetes or how your sugar has been controlled over the last 3 months.
Great. How is diabetes diagnosed?
So the tests that I mentioned earlier, we use those tests to diagnose diabetes. So in terms of, your fasting glucose, if it's more than 126, so 126 is the number, you have diabetes. If your random blood sugar is more than 200 at any point in time, then you have diabetes. And the hemoglobin A1C, again, that is an important number because it tells you a bit long term of how the sugar has been controlled. And if that number is more than 6.5, then that's indicative of diabetes.
Great. Can type 2 diabetes be prevented?
It absolutely can be prevented. So as I said, their risk factors are weight gain, diet, level of activity. And if you keep those in check, if you're losing weight or if you keep your weight in check, if you're relatively active, then you can prevent diabetes. So diet, exercise, your weight, those are the most important things.
How do you know if you have type 1 or type 2 diabetes?
So that sometimes can be a little blurry, the distinction, but there are some tests that your physician can do to differentiate between type 1 and type 2 diabetes. Type 1 diabetes is usually seen in younger individuals, so even children, sometimes young adults, but it may be in later in life also. There are certain tests that your doctor can do.
How important is diet in diabetes?
Diet is very important in diabetes. As I said, it can cause prevention of diabetes. Once you're diabetic, you can keep your sugars in control, monitoring your diet. And if you're on medication, it's very important that you eat at the same time, every day. So if you're on insulin, otherwise there are chances that your blood sugar may go too low, it can be too high. So diet is extremely important to prevent those variations in your diet.
How is diabetes treated?
There are many ways of treating diabetes. One is your lifestyle changes is extremely important. Learning about the disease, so education is extremely important. And there are medications, both oral medications and there are some injectables like insulin that are used to cure diabetes, or I should say used to treat diabetes.
Great. Dr. Merchant, if I have a family member at home that's been recently diagnosed with diabetes, what advice would you give me and my loved ones?
Well, as I said, take care of your diet. And when I say take care of your diet, eat regularly at regular times. Eat around the same quantity of food, so the equal number of calories. A well-balanced diet in terms of the fat content, the carbohydrate content, the simple sugar content, and protein content. So those are really important. Your lifestyle modifications. If, as I said, there is education involved, so you have to understand, what are the symptoms of your sugars being too high? What are the symptoms of your blood sugars dropping? And that can sometimes be catastrophic. So identification of any variation is important. How to use medications, when to use medications, what are the side effects of the medications that you're on. Education around that would be highly important. Keep your day-to-day work at a routine, which is again important. It's a disease that requires discipline. And if you're disciplined enough, I think you can manage the disease really well. Activity, good activity during the day. There are some other things that you need to do if you're diabetic, is regular eye examinations at least once a year, and then it may be more often based on what the results of that are. Foot exam, if you have a little cut or a scrape on your foot, don't ignore it, take it seriously. Checking, following up with your physician on a regular basis to look at any of the complications of diabetes, and simple blood tests on a routine level to look at your kidney functions and your blood sugar control. So those are highly important.
Great. What role does a skilled nursing facility play in the diagnosis of diabetes?
So the skilled nursing facilities, we usually have patients who come in from the hospital, and roughly about 30 to 50% of all residents who end up in a skilled nursing facility, for whatever the reason might be, will have diabetes. So the skilled nursing staff they're very well trained to check blood sugar levels, and they can do finger sticks where they monitor your blood glucose level. The dietitian is available to give dietary recommendations. The meals are served on time. There is rehab staff, both physical and occupational therapy, that can help with managing any loss of function or the activity needed for diabetes. So it's a more managed environment where your meals are and your diet is taken care of. There are professionals, the dietitian, there are the rehab staff, there's the nursing staff who understand and who know how to deal with diabetes. And if there are complications of diabetes, that can be correctly treated. Of course, there is the oversight of the physician and the nurse practitioner or the physician assistant in the SNF.
A lot of great information. I want to thank you for your time and your knowledge, and thanks so much.
Thank you very much.
Thank you.
Welcome to Care for a Healthy You. I'm Kelly with Occupational Therapy.
And I'm Mark from PT.
We're going to go over a few tips today on things that you can do exercise-wise for diabetes.
Yes, these are information, basic tips, exercises, because exercise plays a major role in reducing risk of diabetes complications, including heart disease, stroke, and kidney failure. And aside from that, it also boosts your body use of insulin, it decreases blood pressure, and weight. It helps you to lose weight and maintain your weight. How's that, Kelly?
That sounds great.
All right. Okay, not only that, it also increases your good cholesterol and reduces the bad cholesterol. It lowers your overall body fat, promotes relaxation, and reducing stress, tension, and anxiety.
So we're going to go over a few tips today, just general tips to help you manage diabetes. The first thing we're going to start with is pacing and energy conservation. It sounds like kind of an easy one, but a few things that you want to remember are, in general, day-to-day living, you want to push and not pull. So if you're working in the kitchen, slide things across the countertop. You don't want to be picking up, moving things, putting things down. Remember to always slide. Another thing is when you're in the bathroom, you want to use a shower chair. A lot of people don't realize how much energy you use when you're in the shower and you're standing up. You really want to conserve that energy by using a shower chair. Another thing for the bathroom would be a raised toilet seat, and that'll make it so that your legs aren't exerting as much energy when you're going to sit down and when you're standing back up.
That's a very good tip, Kelly.
Another kind of a tip would be for people that have diabetes to monitor temperature regulation, and that would go along with the water coming out of faucets, both in the tub, the shower, sinks in the kitchen, because if the water gets too hot, you don't want to burn yourself. And that's a very easy thing that can happen. You tend to have decreased sensation when you have diabetes. You can get temperature sensors in general department stores, on Amazon, and that'll just tell you when something is too hot for you to put your hands on. Another thing with temperature regulation is a stove sensor that is going to tell you when, once you've turned the burner off, when the burner is still warm in the area that is still warm around it. And then one other thing would be to avoid using hot pads or hot packs too often, because heat tends to, by the time you feel it, you may have already gotten burned by it. Another tip would be for low vision compensation. Just have magnifying glasses around the house, so that way there, if you find yourself not being able to see something in, say, the living room, you know that you have a bigger magnifying glass that can help you do day-to-day tasks instead of having to go across the room to find your glasses or a magnifying glass. So having them spread around your house is a good idea. And then one of the last things, which is a really big one for diabetes, is to be checking your feet, because people with diabetes tend to be more susceptible to having ulcers. So this is a great tool. This is a mirror that will extend and it bends. So that way there you don't need to be bending over and twisting and turning trying to look at your feet. When you're using this, you also want to make sure that you are looking between your toes, because that tends to be a place where there's a lot more pressure. Along with the checking your feet, once you get out of the shower and your feet are wet, you want to make sure that you dry them extremely well, because any moisture that stays on your foot can again add to the likelihood of ulcers developing. People with diabetes also want to make sure that they have a podiatrist cutting their toenails, trimming their toenails, because if you go to trim your toenails and you nick yourself at all, that could turn into an infection really easily. So it is strongly encouraged that you have a podiatrist come and just trim your toenails. With all that being said, we're going to start with some exercises that are good to do. Keep in mind that when you are doing these exercises, you want to continue monitoring your blood sugar as normal, like you would throughout the day. But keep in mind that before you start doing activities, you want to check it pretty close to before you do any exercises. You want to make sure that your blood sugar is below 250 and above 100. And in that range, you're okay to perform exercise. Anything above that or below that number, you want to avoid exercising at that time until the number either bounces back up or comes down. So Mark is going to start with some leg exercises for us.
Okay, so to start with, we have these basic exercises for your legs. If you can use some weights, you know, to work your muscle more.
Are these 2-pound weights, Mark?
This is 1.5, and you can get this from you know, local sports shops, you know, or you can order it online.
Awesome.
Okay, so first exercise, we're gonna start with leg extension. So we're gonna start seated position. So you can start with your right leg. So you're gonna kick your leg out as high as you can, and then slowly lower your leg. You can do 15 repetitions. You can do that twice a day, one in the morning and one in the afternoon. So it's very important to pace yourself, proper breathing. Yep. In through your nose and out through your mouth. So right leg, and then after that the left leg. So 15 repetitions.
Okay.
Okay, so kick 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, and 15. Okay, how is it, Kelly?
It's good. I can
Good,
feel
you
this
feel
muscle
it?
right
Yep.
here.
So remember to pace yourself, huh? Okay, and now we'll do the other side to make it even. Okay, ready?
Just do 5 for today.
Yeah, we can do 5, but you know, at home make it, you know, do 15, all right? Okay, the other side, kick 1, 2, 3, 4, and 5. Good work. All right, so next exercise is what we call marching. So we can start with your right leg. You're gonna bring your right knee up as high as you can, and then slowly lower your leg. So that's 1, up, and 2, 3, 4, and 5. All right, that's good. And of course, we're gonna do the other side as well. All right, ready?
Ready.
And up, 1, 2, 3, 4, and 5. Okay, so those are basic exercises that you can do at home with your legs. And now Kelly has some arm exercises to do.
Awesome.
All right.
So, just for the sake of time, I'm going to show Mark the exercises. We're going to do 5 repetitions of each exercise. At home, generally, I'd like to see you doing 15 repetitions of each exercise twice a day.
Okay. You want to switch position? We can switch, yep.
So at home you can use light hand weights if you want to. I recommend you starting with no weights and building yourself up to light. These are 2-pound weights if you feel strong enough to do so. So the first exercise to kind of warm up are shoulder rolls. So you start from the back and roll forward.
That feels good.
2, 3, 4, and 5. And that kind of loosens up your shoulders. The next one we're going to be doing are arm twists. So you extend your arms out and you flip your arms completely over. And so this would be number 3, 4, and 5. Followed by the arm twists, we're going to do up and down. So again, with your arms extended all the way out, you're going to go as far as you can. 1, 2, 3, 4, and 5. How do those feel?
It feels good.
Good. To continue with a couple of shoulder exercises, we're going to do internal and external rotation. So you're going to form your hands into a fist and bring them into your belly button. From here, we're going to go all the way out and in for 1, 2, 3, 4, and 5. The next one, I'm going to move out and twist just a little bit. This is called shoulder abduction. So we're going to start with our hands on the outside of our chair.
Outside, okay.
And we're going to come up as far as you can and bring them down. 1,
All right.
2, 3, 4, and 5. And the last ones are more fine motor. It's important to keep your hands moving throughout the day, given you are checking your blood sugar through your fingertips multiple times a day, so we want to keep the blood flowing. So go ahead and make a fist mark and open for 1, 2, 3, 4, and 5. And then with your hands still open, we're going to go ahead and spread our hands apart, nice and big, and
right.
in. Bring them back in.
Oh.
2, 3, 4, and 5. And then the last one, go ahead and rest your arms on the arms of your chair. You want your wrists to be dangling. You can use a table for this, but it is important that your wrists are not supported. And we're going to bring our wrists up and down. 2, 3, 4, and 5. Good. So those are a few arm exercises to kind of keep your blood flowing that I would recommend for people that have diabetes.
Remember, you know, if you eat good, you will feel good. And if you feel good, you will look good.
So that ends our segment. We hope that these tips help you manage your diabetes and lead a happy, healthy lifestyle. Thank you.
All right, thank you.
Hello and welcome to the nutrition segment of Care for a Healthy You. I'm Jocelyn O'Brien, the clinical dietitian at Care One at Lexington. March, as you know, is Diabetes Awareness Month and also National Nutrition Month. We'll talk about those two today, and we'll also review the new dietary guidelines that tie in with both months. National Nutrition Month is a month where we focus on nutrition education and information to better serve everyone. It's done annually by the Academy of Nutrition and Dietetics, and it helps provide information on food choices and help people develop sound eating and physical activity habits. The theme this year is Savor the Flavor of Eating Right. It encourages everyone to take the time to enjoy the food traditions they're accustomed to. Appreciate the pleasure of great flavors and social experiences that food can add to our lives. How, when, why, and where we eat are just as important as what we eat. It's important to develop mindful eating patterns that include nutritious and flavorful foods. In managing diabetes, those things are very important as well. A healthy eating pattern, regular physical activity, and often pharmacology that includes medication are the key to manage your diabetes. What's the most challenging part of managing your diabetes? What do we eat? The American Diabetes Association states that there's no one-size-fits-all. Everyone should have their own customized and individual meal plan that they can create with a registered dietitian and emphasize on portion size, timing of the meals, maintaining your weight, to delay the diabetes complications that may occur. If we look at carbohydrates, there's inconsistent information about the ideal amount of carbohydrates that people should have at every meal. It's recommended that your carbohydrates come from fruit, vegetable, whole grains, legumes, and low-fat dairy products. Trying to stay away from carbohydrates that have added fats, sugar, and sodium is probably a good idea, as it contains a lot of calories. Dietary fiber is very important and help manage your diabetes and your weight. And the general population guidelines, which is the same as for diabetic patients, is between 25 and 30 grams of fiber per day. High fiber foods includes whole grains, whole wheat products, fresh fruits, fresh vegetables. Protein is also important. There's a certain amount of protein that people ask that they need to have at every meal. And again, it has to be customized and individualized. If you have renal impairment or your kidneys are not functioning too well, you might be limiting your protein to help them work better. If we look at fats, as we talked about in our February episode, moderation, quality, and the quantity of fat that you use is very important. Alcohol also needs to be limited. For women, the recommendation is 1 or less drink per day, and for men, 2 or less drink per day, as it may delay signs of low blood sugar, also called hypoglycemia. Sodium is also something to be careful with. For the general population, it's usually recommended to consume less than 2,300 milligrams of sodium per day. Reading food labels is key to achieving that number. If you look at a reading label, like you see on the screen, the 140 milligram is the guidelines you want to look for each serving size. So if you find a food that has 140 milligrams or less of salt, that would be a good choice. It might be also more restricted in some conditions like CHF, like we talked about last month, or other cardiac issues that you may have. So you might want to check with your physician or dietitian. For vitamin, minerals, and herbal supplements, always talk to your doctor or your registered dietitian, as it can interact with some medication. For herbal supplements, there's very low evidence that they may help with diabetes. So be careful when you see ads of certain things that may help or promise different things. If you take a look at the plate that we have on the screen, your plate should be looking like this. Half of it should be low carbohydrates vegetables, so a fresh salad, some kale, some broccoli to fill half of your plate. In the lower corner of the plate, you see the protein. And you always want to choose lean protein, so lean cuts of meats, fish, poultry, egg, or soy products. In the top corner, you have your grains or your starchy vegetables. That includes potatoes, whole grain rice, whole wheat pasta, or any other grains you can think of, and dairy. So very important to get your calcium and your protein from your dairy product, and it could be a regular or a soy milk or almond milk. And then fruit, to have a piece of fruit to balance out your meal. So now that you know what your plate looks like, let's talk about some dietary guidelines that will help you make healthy choices and that are not a strict prescription on what you should and should not eat. The first guideline is follow a healthy eating pattern across the lifespan. So choosing a healthy eating pattern at an appropriate calorie level to help you maintain your weight throughout your lifespan. The second guideline is to focus on variety, nutrient density, and the amount. So to really look at a variety of different foods. For example, for your vegetables, we always say you want to eat the rainbow, all different colors, to bring in different nutrients and vitamins to your diet. And also be careful with the amount that you eat. Moderate portion sizes and amount of different things that you may consume. The third guidelines is to limit calories from added sugars and saturated fats and reduce your sodium intake. So we talked a little bit about the sodium intake and also reducing the amount of sweets and saturated fats, as it provides added calories that could make it hard to maintain a healthy body weight. The fourth guideline is to shift to healthier food and beverages choices. So making changes one at a time is very important. It could be challenging to make too many changes at once. We recommend to focus on one change, stick to it, and when you're comfortable with it, make another one. And the fifth and last guideline is to support healthy eating patterns for all, making sure that your eating patterns fit your lifestyle, fits where you are, if it's whether you're at school, at work, or in the community, and that it's something that you can commit to. I hope you enjoyed the nutrition segment of Care for a Healthy You and learned some valuable information. Thank you for watching, and we'll see you next time.
Thank you. It has been another episode of Learning and Knowledge. We hope to see you for our next episode. This is Care for a Healthy You. Welcome to our second episode. This is Care for a Healthy You. This month we will be discussing diabetes. At the end of our time together, we hope everyone has a better understanding of the disease process and treatment options and how the rehab services can help in the recovery of patients. We hope to see you next month. We will be learning about pain management. Hi, I'm Chad Waterman, the Assistant Administrator here at Care 1 at Lexington. I'm here with Dr. Merchant, the Associate Clinical Professor of Tufts School of Medicine, Clinical Instructor at Harvard Medical School, the President of AMDA Society of Post-Acute and Long-Term Care Medicine, Massachusetts and Rhode Island Chapter.